The Value-Based Purchasing Advisor is a small button that floats on top of the organization's EMR and monitors the quality of care provided to the patient in real time, in accordance with CMS's Value-Based Purchasing Guidelines for Clinical Process of Care. The advisor reads all patient information from both the EMR and all the other ancillary systems at the organization that hold patient information, including lab results, pharmacy, radiology, and physician's dictations. And yes, for its accurate performance, beyond just collecting information entered into the EMR's structured fields, the advisor also reads free text notes that are entered by physicians and nurses to the EMR, and notes dictated to the organization's dictation system. The advisor's capability to read free text notes as well as structured data makes it a very accurate data agent that collects all patient information, regardless of where it's entered or in what format, structured or unstructured, making it an effective tool that keeps a comprehensive snapshot of the patient's data at any given moment. So what does the advisor do with this data? The Value-Based Purchasing Advisor is loaded with all of the CMS Clinical Process of Care measures and protocols for fiscal years 2014, 2015, and 2016. These best practices can be fully customized to represent the organization's unique approach to clinical practice and workflow in each of these measures, so the advisor should be well-tuned to work according to your daily workflow with your patients and documentation. The role of the advisor is to continuously monitor the care delivery and documentation quality for each patient that falls into any of the CMS Clinical Process of Care measures and protocols, and identify any deviations or deficiencies in the care provided, in real time. Once a deficiency is identified, the advisor prompts the clinical staff to make them aware of such a deficiency and to assist in providing the best care, anytime. So let's see how it works. It's very simple. First, the advisor is actually invisible. It floats in the background, behind the scenes, and quietly monitors everything that's documented about the patient in real time, both the free text and structured information entered into the EMR, as well as any other information entered into the organization's ancillary systems. The advisor appears on the screen only when a deviation from the expected care or compliance with any of the CMS Clinical Process of Care measures and protocols is identified, or when a clinical error associated with these measures is about to be made. In this case, a 65-year-old patient with a medical history of ischemic heart disease, diabetes mellitus, hyperlipidemia, and hypertension is rushed to the ED after having a sudden onset of chest pain and shortness of breath that started 30 minutes ago while he was visiting his daughter in the obstetrics department. He was diagnosed with ST segment elevation myocardial infarction. The following EMR represents the hospital's EMR where the documentation about the patient is entered. Although you don't see the advisor button, it silently runs in the background, monitoring. It does the same on top of all of the major Microsoft-based EMRs, like Cerner, Epic, Allscripts, McKesson, Siemens, Sorian, and others. As can be seen, the patient is known to this hospital and has some previous background information, narrative text from his previous discharge summary from over a year ago. Currently, the physician documents the fact that the patient has an acute MI, and since the patient and family refuse PCI, alteplase is ordered. However, immediately upon completion of the documentation, within a few milliseconds, the MedCPU Advisor pops up on the screen with a contraindication prompt, indicating that TPA is contraindicated. Why is that? Looking at the explanation for this contraindication, it says that the patient has a brain aneurysm, and therefore TPA is contraindicated. So what happened? Well, let's see. Within the narrative text in the discharge summary from over a year ago, it's written that there was an incidental finding of a cerebral aneurysm of the internal carotid artery, and obviously that's why TPA is contraindicated. The advisor was able to find something that the ER staff would normally have difficulty finding. With so much documentation that exists on a patient, from years of history and mainly narrative unusable information, it becomes almost impossible to grasp it all in the emergent ER setting. But through its ability to read everything in the chart and understand the free text notes and summaries, the advisor becomes a crucial tool that does not miss the critical information and is able to assist the clinician in avoiding mistakes, in these critical moments. In this case, the advisor acted based on the CMS Clinical Process of Care measure AMI 7A, fibrinolytic therapy for AMI patients received within 30 minutes of hospital arrival, and assisted the clinician to both comply with this measure and avoid a life-threatening error. Canceling this order may be the next advisable step, but the advisor also stays tuned to the physician's reaction, and in this case, the physician responds by documenting in the chart: consultation with neurologist. On previous visit to ER, patient came in after a trip and fall. Revision of head CT from this visit shows no evidence of cerebral aneurysm. Thrombolytic medication should not be withheld. The advisor continuously reads everything that's documented in the chart, and immediately upon the documentation of this narrative note, it reacts. The contraindication to TPA goes away, and the button pops up, now blinking important. Clicking on the advisor reveals the reason. Time last known well is missing, and clicking on the prompt shows the explanation for it. The patient has acute MI. Time of symptoms onset should be documented to guide further evaluation and treatment. Obviously, before proceeding with TPA, this important item must be evaluated, and since it was not documented until now, the advisor finds it as a critical deficiency, prompting and assisting the clinician to take the right next step. And again, all based on measure AMI 7A of the CMS Clinical Process of Care measures list. Providing the required documentation, narrative or structured, immediately turns the advisor green, OK, and it quickly disappears from the screen. 24 hours after the patient is hospitalized, the physician proceeds with ordering Lovenox for VTE prevention. However, the advisor immediately pops up with a contraindication alert that enoxaparin sodium is contraindicated. And why? Of course, thrombolytic therapy was given less than 48 hours ago. Enoxaparin sodium is contraindicated. Now it's measure SCIP VTE1 of the CMS Clinical Process of Care measures list that is activated. Canceling Lovenox turns the advisor OK, and it then disappears from the screen. 24 hours later, the advisor appears again. As you can see, the advisor is not embedded in the EMR. It floats on top of the EMR and can be moved across the screen to any convenient location. Clicking on the flashing button presents what's missing: VTE prophylaxis. The patient is hospitalized for more than 48 hours. TPA has been given more than 48 hours ago. VTE prophylaxis is indicated. Indeed, assisting the clinician in following up and complying with measure SCIP VTE1 and initiating the appropriate clinical approach to this patient. Starting Lovenox turns the button OK and removes it from the screen. This concludes the short demonstration of the functionality of the Value-Based Purchasing Advisor. Thanks for watching.